All right, let's take you back then to our leading story for tonight. President Cyril Ramaphosa and Health Minister Dr Zweli Mkhize were among the first citizens to get inoculated with the newly acquired Johnson & Johnson vaccine. It arrived in South Africa on Tuesday night. The president announced that the first batch of 80,000 doses of the vaccine is being prepared for distribution across the country with immediate effect. Dr Zweli Mkhize is the health minister and joins me now. Dr. Mkhize, good evening and thank you so much for your time. You weren't by yourself in this moment. You're surrounded by many scientists that have been doing a lot of work, I suppose, not just on the COVAX and COVID-19 program, but, some pointing to the fact that many of these faces would have also been the very same scientists who were there when South Africa received its very first treatment of antiretrovirals and the rollout of that program. So I suppose a coming full moment in many different ways.
Yes, certainly we have, the good fortune of having very experienced scientists, researchers and academics in our country who have been with us as we're dealing with various pandemics. And in this case, this team has been ably led by people who have been part of that. So the chairpersons of the ministerial advisory committees are accomplished professors in their own rank, in their own right, and also the team that's been working with us, in this case from the Medical Research Council, also are very well respected scientists and researchers.
Let's talk about then the next steps, because this moment, I imagine, has given a lot of hope to many other health workers in particular who would want to know when they're going to have their moment of receiving this vaccines. Talk to me about some of the timelines that you're working around now.
Well, we have started with the first 80,000 doses, which we hope that we should go through within the next 10 to 14 days. By which time we should also be having a next batch that should be coming through. And we are looking at the next, say, 6 or so weeks, being able to get 500,000 from Johnson & Johnson. And in the process, there'll also be some coming from Pfizer. And we really want to expand our capacity to open up the plan that we had originally put in place for the rollout when we were looking at the AstraZeneca doses. So we expect that increasingly the numbers are going to be coming out. At the moment, we've got 400,000 health workers who have registered, and we believe that number has to increase to beyond 1 million, and so we must reach out to that million, maybe 1.4, 1.3 million, 1.25 to 1.5 million. What is good with this one in particular is that it's a once-off injection, which means that whoever will have dealt with now will not have to repeat the vaccination. But later on, when the other types of vaccines come, of course, people will be coming for the second dose later. So we believe, therefore, that there's a lot of work that needs to be done. We have to reorganize our timeframes a little bit to face the fact that the supplies, they'll give us a concrete sense of how many doses are coming per week, per month, so that we are able to adjust the speed with which we are able to vaccinate those vaccines.
You're bringing me to my next point, because this is about as simple as the process is going to be. From here on, it sounds like it's going to get rather complex, not just with the arrival of different vaccines from different manufacturers, but also the distribution of those vaccines in the country. What are some of the agreements that you've been working on right now, especially for ordinary members of the public who would want to know, are they going to be expected to pay for their own vaccines? Have the conversations with the medical aid schemes, have those been finalized about whether there will be some kind of subsidy for these vaccines coming through from their side as well?
Well, government is paying for the vaccines and the medical aids will pay for the vaccines. We'll also have some contribution from the private sector. But what we expect, what we have indicated the situation to be, is that for anyone who gets a vaccine, they should not pay anything. If either if they've got a medical aid that which will be charged to the medical aid, which means for both the vaccine and all the consumables such as the syringes, the swabs, and so on, that all be paid by the medical scheme. We've had a discussion with them. We've also changed the regulation so that it's possible for them to pay for that. And then on the other side, if you don't have that capacity, then of course the government will carry the cost, because the vaccines are a matter of public good. So we really want to vaccinate as many South Africans as possible, irrespective of their ability to pay.
In terms of timelines, when do you think it will be that South Africans who are not part of the first phase of this rollout will begin to get vaccinated?
We had set up a period of 3 months for the first phase, which would be 1.5 million people that must be vaccinated. Then the next phase, the second phase, which will be about 16 million people, we have put up a timeline of about 6 months for that. And then the last phase will be beyond 3 months and beyond, because by then we'll just be taking those who will be coming. The majority could have been covered by then. So what we are trying now to do, as we did earlier, to bring the dates earlier for vaccination, we want to also try and vaccinate as many people as possible and get more dosages early, so that we don't have to wait for the full 3 months for it. But we want to make sure that we've got enough doses to be able to vaccinate more people in the second group, because they're still very, very important, frontline workers. There are people who are exposed as well because of the community work that they do. So we have to really try and squeeze as much as possible within the time that's limited available to us.
Minister, there's been a lot of talk about this AstraZeneca vaccine and what then becomes of it now that it has been found to be not highly efficient in South Africa in particular. Is the African Union going to be buying the doses that we have?
Yes, certainly. I think it's important to just remind people that, in fact, the vaccines have not expired. We still got enough time to be able to get them utilized before the end of April. And so that on its own is supposed to be understood that they are very safe to use. So there are many countries. We have actually had over 25 countries that have come forth to request that we sell to them. We've then offered the vaccines to the African Union platform, because that way it's able to distribute to a large number of countries to help their health workers to get vaccinated. So they will be paying for that, so there will be no fruitless or wasteful expenditure.
And how would you describe the relationship right now between our health department and that of the Serum Institute of India? Because reports suggesting that things had soured after they declined to send the country new vaccines that weren't expiring so quickly.
I don't know where that story comes from. We have a very good relationship with the Serum Institute of India, with the government of India. There is no problem whatsoever. We've never actually asked them to take back the vaccines. We're not sending them back. We're using them in the continent of Africa. And so the relationship has really not changed. And of course, once there's a story that's a bit of a controversy, lots of people begin to be experts and give us information that we don't know where it comes from. So as far as we are concerned, there is no issue. There's no issue as such, but we will be offering this to the African Union platform, which I'm part of. And so I know for a fact that a number of countries that have raised their hands to ask that they must be given the consignment for their own use, particularly focusing on the health workers. We believe it's important to do so because, the issue of AstraZeneca is being investigated here in South Africa because of the variant. And so we would imagine that for many countries that have got, that don't have the same type of variant, it should be possible to utilize the AstraZeneca vaccine in the central, east, and the northern and western part of the continent without any problems. And then, of course, in our areas here, we need to then assess where there would be a need for us to change or give a multiplicity of vaccines. So we have no problem. We believe that, in fact, it's going to turn out to be better for us because we're now able to help more countries with the availability of this vaccine. Whereas in our case, whilst we're doing the investigation, we'll not be using them. So it's a win-win for everybody.
So, Minister, just so I understand clearly, you're saying that you never asked the Serum Institute of India to take back these vaccines. But when I think back to a briefing that was held that included your Director General, he did indicate that you would be communicating, well, maybe not yourself directly, but the department would be communicating with the Institute to find out what the alternatives could be to try and mitigate against this issue of the expiry date. So are you saying that that never happened?
Now, I'm saying what we said was that there are many options that we can think about. One option would be to discuss if we are unable to use the vaccines by the time we get to the expiry date. We'll then talk to them to see whether there's any option about it. But we never got to that point. Then we also said we were going to look for all possibilities of utilizing the vaccine long before the expiry date so that the issue does not arise. So where we are, we're at a point where we don't need to send it back. We're at a point where it will be used before the expiry date. We're at a point where many countries are going to benefit from it.
How soon are you expecting the COVAX facility to start supplying some of the vaccines and for some of those vials to come on board?
Well, they've indicated that their date will be around April, but then they've also undertaken to give us some vaccines earlier. So they were suggesting that there could be a couple of 100,000 that could come in March. And so we're waiting for them to confirm that. But the main date was supposed to be April. But then we asked them to try and bring some of the doses earlier than that date. So it's possible that we could be getting some around March. I think they've given us an indication that they could send just under 150,000 at that time. So we're still talking to them. Once it's firmed up, we'll be able to say this is the date and this is the amount.
Minister, just before I let you go, one of the issues that has been raised as a matter of concern has been around the black market for COVID-19 vaccines and the development of fake vaccines. How much is government thinking about this and perhaps the plan that you are working on to ensure that there is no black market, or if there is, that it doesn't thrive, at least in South Africa?
Well, on the acquisition side, we think that we'll have it pretty much under control because we're discussing directly with the manufacturing companies. We're also making sure that since the government is going to procure, then everything else will be moving from government supplies. So that side is much safer. We'll also make sure that any vaccine that gets into our hands goes through the necessary quality assurance tests. And once that is done, we know that there's no risk of fake vaccines. But then we also are going to be, because we are issuing the vaccines free of charge to the individuals, individual South Africans, we believe that there is not much space for a black market because, why would someone want to go and buy something that they can get free? And so we'll just make sure that our people are continuously informed that, they should be waiting for their turn. And as soon as those vaccines are available, they should be able to get onto the queue and get themselves vaccinated.
All right, let's leave it there for tonight. Thank you so much for your time. That was Health Minister Dr. Zweli Mkhize.